Hello and welcome back, my friends. If you're new here, my name is Laura, and I usually make videos about hypermobile Ehlers-Danlos syndrome to help educate, raise awareness, and share my experiences and advice living with this condition. But today I am straying away from my usual hypermobile EDS content to talk about myopathic Ehlers-Danlos syndrome. This is part of a video series where I give each of the 12 rarer subtypes of EDS their own introductory educational video. I have several videos out already, so please go check them out if you're interested, and stay tuned for future videos in this Rare Subtype Series. So what exactly is myopathic Ehlers-Danlos syndrome? Myopathic EDS, also known as MEDS, is an extremely rare condition that causes muscle weakness in infancy and childhood, delayed gross motor development, which is the learned process of moving the major muscles in the arms, legs, and torso, joint hypermobility, which are joints that move past a normal range of motion, and joint contractures, which is permanent tightening of the tissues around a joint that limits its range of motion. Myopathic EDS belongs to a group of 13 related but separate genetic connective tissue disorders known as the Ehlers-Danlos syndromes. The hypermobile subtype of EDS, which is the type that I have, is by far the most common, accounting for about 90% of all EDS cases. The myopathic subtype is extremely rare and accounts for less than 1% of all EDS cases and has a prevalence of less than 1 in a million people. MEDS is caused by genetic variants found on the COL12A gene. This genetic variant negatively affects the way the body produces type 7 collagen, which provides support, protection, and structure throughout the body. Myopathic EDS can be inherited in either an autosomal dominant or an autosomal recessive pattern. Autosomal means the condition can be passed on and inherited equally by males and females. Dominant inheritance means that people with the condition might only have one pathogenic variant and in very rare cases could have two. In the more common case of having one dominant pathogenic variant, people with the condition have a 50% chance of passing the condition on to each child they have. Recessive inheritance means the condition only occurs when both copies of a gene are affected by pathogenic variants. A person with two pathogenic variants in the same gene will always pass on one pathogenic variant to their children. Their children will only have the condition if they inherit a second pathogenic variant in the same gene from their other parent. People with only one recessive pathogenic variant are known as carriers, and they do not have the condition themselves. The autosomal recessive form of MEDS causes more severe symptoms that are present from birth, while the autosomal dominant form of MEDS is milder and presents in childhood. Myopathic EDS is diagnosed through genetic testing, and genetic testing should be considered on anyone who meets the diagnostic criteria for MEDS. The diagnostic criteria are separated into major and minor criteria. To meet the diagnostic criteria for MEDS, a person must meet major criterion 1 and at least one other major criterion, or meet major criterion 1 and at least 3 minor criteria. Major criterion 1 is the presence of congenital muscle hypotonia, which means low muscle tone at birth, and/or muscle atrophy, which is a loss of muscle tissue causing unusually small appearing muscles that improves with age. Major criterion 2 is the presence of joint contractures of the hips, knees, and/or elbows. Major criterion 3 is the presence of joint hypermobility in the fingers, hands, wrists, toes, feet, and/or ankles. The 4 minor criteria include the presence of soft, doughy skin, atrophic scarring, which are scars that indent into the skin, motor developmental delay, and muscle biopsy-proven myopathy, which is diseased muscle tissue. Because myopathic EDS is a genetic disorder that you're born with, there is no cure, but there are many treatment options available. MEDS is managed by treating the various symptoms that each individual is experiencing. There's no one-size-fits-all treatment. Key aspects of care can include preventing injuries and doing physical therapy. Treatment options to help manage the many symptoms of MEDS may include medication, pain management, joint bracing, mobility aids, surgery, and physical therapy. Do you or anyone you know have myopathic Ehlers-Danlos syndrome? Let me know down in the comment section. I'd love to hear your story. If you thought this video was helpful, please click on the like button. If you want to see more videos like this, subscribe to my channel, and don't worry, it's completely free. If you click on the notification bell icon, you will be notified when I release new videos. As always, thanks for watching and see you next time.